Is an interesting request.
Yeah, because he was like, I was talking to Alexis about something and my voice is all funny, and I think I was bugging him that it didn't sound like normal. I was like, it's not gonna do anything, but sure, I'll clear my throat for you.
The excitement continues to build. Okay, so where are we here? We were talking about vaccines. So, so we got our cow, calf. Best cow vaccine is colostrum, at least to get them started. So there's nothing else you can really do for them at that point. So we've got all moms circulating IgGs, immunoglobulin G. She transfers that subset, and hopefully the calf can make that last until it can take over and start producing its own. So you've got basically a lifetime of experience with the cow being transferred to that calf for the short run. So if that cow has been in the environment that that calf is going to be in, there should be pretty good coverage to get things started. Come on, you can do it. So if you're going to vaccinate the dam, we need to think about a killed virus. Why is that? Harm the fetus and or may abort the pregnancy. So we could do a modified live if the pregnancy is not there, assuming that they've done all the things that they're supposed to make sure that it doesn't actually give the disease to the animal. We don't want the vaccination to be as bad as the disease. Although there was a lot of discussion during COVID, well, let's just let everybody get it. And, your immunity is best, right? But the problem is grandma had to die. So for that herd immunity. So there were some people in Texas that were okay with that. Um, yeah, there was one guy, I think he was like the lieutenant governor. It was like, well, grandma's willing to die for the US economy. I'm like,
It's like when you send your kids into war, except it's your grandparents just to be killed off by disease.
well, you hope in war, but yeah, so um herd immunity is something to be said for that. But certainly acquiring the reason for vaccines is we're trying to develop an immunity without the risk of death. So um, that's there. I guess the vaccines in one form or another have been around since the revolution. They said, what is it? George Washington vaccinated his troops by, I think it was, they found that if you had cowpox, that conferred immunity for smallpox. So if you smeared gave your troops cowpox, and I think he did that, he didn't have to worry about smallpox outbreaks in the troops. I think that's the one he did. I know he smeared something on him to give immunity for something. I think it was smallpox. So the IgGs that are manufactured by the third line of defense in the cow, the active immune system. Remember, we got the passive immune system, which is all the barriers in the body. We got the active non-specific, where we just attack willy-nilly. And then we have the targeted assassins from the specific that go after specific targets. And there, so you're giving the cow's active, whatever she's experienced in her life, which is why if you test colostrum, at least people that have, well, I don't test anymore. Sometimes the heifers are okay. All the mature cows are okay. So they've been around long enough. They've been exposed to everything. They get the immunoglobulin levels up to where they're supposed to. So it's like I just give mature cow colostrum. So they've been exposed to everything, and that's the thing we can deal with. Intranasal vaccinations. I don't fully understand how these get done, but we have an interferon response which is not exactly, I don't think, an antibody or an immunoglobulin, but it does have antimicrobial properties. So we've got immune interferon levels. When I was growing up, it was going to be the cure all to everything when they found it. They were using it to cure cancer, things like that. It sort of worked, sort of didn't. It never got approved, and people were going to Mexico to get interferon infusions. So you've got the intermuscular response, you've got the intranasal response. So you're going to meet that immune system that's sitting in there in the lungs, and you're going to probably have a much more dramatic response than the amount of white blood cells in the muscle. So I think it's just a matter of where that is introduced and what immune system is present. We know the white blood cells, the eosinophils in the lungs are there, and they're going to react and create that immune response. In this case, measured in interferon titer. So the more interferon you have, the more antimicrobial activity you have in the body. So better and faster than intermuscular. That's what that diagram shows. And you're looking at IgA as opposed to colostrum or blood IgG. IgA tends to float through or be dispersed in the mucose secretions. So we think about the nose and the mouth. That antimicrobial activity taking care of what's there. So that intranasal, you've got a lot of white blood cells in that pathway that are going to get stimulated very quickly. So thinking about vaccination, we think about vaccinating all at-risk animals, assuming they're going to be able to respond. So we don't know or can't measure necessarily if they've got a defective immune system, but we can know what their immune or health status is, what we've done to them recently. We want to have enough nutrients there to make sure that they can support an immune response, do one that's need there. So we vaccinate to stimulate an immune response. We want to have that immune system prepared for when the real culprit shows up. So we want to vaccinate prior to exposure. Once you've been exposed, there's really no benefit to the vaccine because the body's learning directly what a live attacker is, and that a live attacker is going to be broken up into antigens to be processed in the immune system. So vaccination is redundant once you've been really exposed to it. We certainly want to think about the area we live in, talk to our vets, which things make sense to vaccinate in a particular area. So vaccinating against the known risks in the area, the likely exposures, and the working vaccines for those known exposures. So evaluate the economics. A lot of people are thinking about, this is $5, $10 a dose for an entire herd. That's not an insignificant amount of money. Is it worth it if there's no known risk around? So you evaluate those things out, making sure things get done. And then we want to make sure if we're going to do it, let's do it right and follow those manufacturers' recommendations, making sure we do the right age, we do the boosters at the right time. We make sure that we store the vaccines properly and making sure that we handle them all the way to injection properly, making sure we're timing things so the animals are not under stress. So avoiding abrupt changes in weather is probably a good time to avoid. Certainly the weaning, the dehorning, all those things are going to weaken the immune response and not make the vaccines as effective. So it's just one of your tools. Again, there's a lot of things that just doing things right are going to take you a long way. But if we do everything else wrong, vaccinations are probably not going to help us all that much. That's probably not the best use of your money. Maybe you're better off spending it on betting than vaccines sometimes. Any questions on vaccines? Okay, that's the last. We're about to do the last prepared set of slides here, which means I timed the semester reasonably right. So, surgical procedures. So, things we do with our cows that are modifications that are available to us. Sometimes we're not supposed to use them. So we'll see what are the recommendations as we go through these. So surgical procedures. So what are some typical surgical procedures? And we're using the term surgical loosely. So disbudding, dehorning, ear notching, and removal of extra teats. So certainly the disbudding or dehorning. So if we get it early enough before that horn anchors itself to the skull, we can make things a little less painful, a little less gory, I guess. Thinking back to some of the things that I experienced or watching my dad do his work as a kid. It's like, Dad, there's a hole in its head. So I didn't realize it was the sinuses. I thought it was the brain. So, so why is it necessary? Why do we do this? We don't have a polled breeding stock yet, so horns are dangerous to humans. They are dangerous to other animals, and they don't really serve a function. In our current management systems, there's no need for defense against wolves or anything like that. Everybody's seen the pictures of the uroks in Europe, the progenitor, big, somewhere between a cow and a water buffalo or a bison. So, those big hairy things that used to have to defend themselves in Europe. So no longer with us. So we can't. They're working on it, but the problem is, well, genomically, polled animals are extremely valuable. The problem is getting those genes into the other animals. The ones with horns have the highest milk production, the best type. So trying to elevate polled into animals that everybody's willing to use is the challenge. So it's going to take a while. Everybody knows from genetics, the more things you select for, the slower progress you make in each one, right? You've had that with genetics. So if I just do milk production, I'm going to do really great and go forward. But if I do milk production and feet and legs and udders all at the same time, I'm never going to do as well as I could in each of those areas if I just selected that area. They're pulled, yep, they're pulled beef breeds. They're
Focus on.
Well, it just happened, and then they bred them, crossbred them, so they get the polls into the animals that are the most desirable from a meat standpoint. Yeah, there's naturally pulled animals. It's just gonna take a while, that's all. I think Marshman has a polled red and white, if I'm not mistaken, that is very valuable, or was very valuable. I don't know if they still have it. So may cause carcass defects. you're also going to get docked because you have horns, right? So if you're sitting there at the auction, what is a buyer? If you're there for Cargill and you're there trying to buy hamburger, what are you going to do when you see horns? Well, that's 5 pounds I can't use, so they start taking deductions. If I can't use that leg, so carcass defects. If I can't use that udder is not saleable meat, and that's 100 pounds there. They start subtracting things off, and then they figure out what they're going to pay, even though usable hanging weight that they have. So carcass defects, especially when you're starting to move those animals around, they're getting jostled around. Unless you do what they do with the Ashars when they do shape those horns and bring them around front and all that fun stuff. We had the Snooks growing up at the fair, always shaping those horns on the Ashars. They usually won the Ashar contest every year because they were the main breeder in the county. So carcass defects may make handling a pain. So you've got getting the animals through headlocks with horns. Most of them figure it out. And then you have the Houdinis. Everybody's seen those cows that can lock and unlock other animals.
Yes. Yeah. That's every single goat alive.
So they got enough time to figure that out. They know what those horns can and can't do. They know exactly where they are. So this was a nice thing that Professor Marshall found. Let's take a look.
Bill. Your kid, that's. You're gone.
Yeah, if a cow has the only one with horns, she knows it, usually in the herd too, and uses it to her best advantage. So
She's like, I just want to get in here.
never seen the handles molding in like that. I wonder how many teeth she's broken doing that.
Probably at least a few. She got like none.
Not that front teeth are too critical, but like I said, they know.
Oh, yeah.
They know what they have and they know where they extend to. Um,
Do the same,
yeah,
except it's all of them. All of them. My board goats.
I would imagine, yeah, it's easily passed down. One sees it and going through. So
Or they'll just magically learn how to jump 7 feet in the air.
one or the other. So where were we? So
Then we get.
I guess I need to. Okay, so that's my vaca we lista. I think from the title it said my cow is very smart. Um, so while we're here, we should probably check that. Okay, back to where we were. So disbudding, the removal of the horn prior to attaching to the skull. So you're looking at something that happens very early in life. So the faster we can get to that, um, the less invasive it is on that animal, less pains involved. So getting that done early. Removal of the horn bud after it's attached to the skull, and that becomes a much more difficult and sometimes gruesome and bloody procedure. So the horn bud attaches to the skull somewhere around 1 month. So we need to get things done before that to make life a whole lot easier. Have I know? So we tried it, I think, up at the dairy for a while, and it just gets all over everything, and you got to keep it out of their eyes and all that stuff, and it just um I think it's if you can keep the dehorner or whatever hot enough, I think it goes a whole lot faster than the paste. So when should be done? The earlier the better. It's a lot better if we can do it within a week, but definitely before things start to attach at 4 weeks. So they're looking at that 3 weeks. So figuring out where we're going to do all our different procedures, making sure they get by the diarrhea stressors. So maybe that 2 to 3 weeks is a good spot for that. Specific timeline depends on the method used. So there are options out there, the caustic paste that will basically eat away at the skin, destroy that tissue. You've got the hot iron dehorner. There's a number of sharp tubes, cups, scoops that you can basically cut it out with like a cookie cutter. You've got the gorges, you've got the dehorners, and the gilly wire. So, so caustic paste, what is it? Mixture of caustic substances. So it's going to cauterize the tissue and kill it, and it's going to stop that horn tissue from growing. The challenge with the paste is making sure you get enough on all the locations, because I've seen a lot with those where maybe we don't get everything, or we don't get enough paste on this side. You still get that stupid thing that grows out, a little half a horn or whatever it is, a nubbin. So what age should be done? Earlier the better. Less than 3 days is ideal. Some may be longer, but again, you probably want to get it done before the attachment occurs and you've had an opportunity for those tissues to grow. The less tissue we have to get rid of with that paste, the better off we are. So how's it done? You put petroleum jelly around the outside. So that's going to slow the penetration. So I think there's a shave. There should be. Is it in here? Shaving should be done. Making sure you get rid of all that hair, although the hair will dissolve. But you kind of set a border with that petroleum jelly, and you focus on the center of that ring. That helps prevent the paste from moving and getting to other areas. The problem is when the calves start scratching their heads on all the materials and everything, that's going to start to move things around. So apply it to the paste to the area using an applicator. We probably don't want to use our fingers, things like that. I'm not sure if it eats gloves or not. We think about pain mitigation. It's certainly going to be uncomfortable until those nerve endings get destroyed. So feeding your non-inflammatory, non-steroidal, anti-inflammatory drugs. Used to be aspirin. We're not asked not to use that anymore. The use of lidocaine to numb things up. So we're not dealing with the itching and things like that is increasing. I understand that dehorning was an interesting process yesterday at the goat farm. They put some of them out and they didn't come around for several hours. So the problem with that is the microbes, if they're, well, they're not really ruminants. You're talking about the little ones, right? They're not ruminants yet, but if they're ruminants, you're going to have things bubbling and stuff, and that's all going to get in the lungs. You're putting them out, so you don't want that. Do that. So advantages might be less painful than the hot iron. The hot iron should, if it's done right, kill the nerves instantly. Like a second-degree burn is worse than a third-degree burn. Everybody knows that.
Yes.
So third-degree burn, you charred the tissue, and there should be no nerve endings left. So should be bloodless, should be less invasive on the animal. There's a challenge there. Disadvantages, you can't do it in a group setting because if they're butting each other, you're going to have little pock marks all over their bodies. You need to do protection from precipitation. That caustic paste will move with the water. And probably the first target when it starts to move is the eye. So that's not where we want to be. You need to apply an adequate amount, and there's an unknown element that suggests, hey, we might fail as we move through. So the other kind of recommended approach is the hot iron. So a couple different ways to heat that up. You've got cords, you've got battery packs, you've got burners that can heat that up. Trying to get something that's red hot. We try to apply that on with a circle just bigger than the bud to kill all that horn tissue on the outside, to decrease the blood supply to that tissue and hopefully kill it all. So we need red hot, and everybody knows what red hot is. It's 1300 degrees Fahrenheit. Red hot for steel. I think red hot is somewhere in that neighborhood. White hot is like 2000. So, but I could be wrong on those. But yeah, it's way hotter than anything we should be coming in contact with. When should be done? Again, the earlier, the better. As soon as you can feel those horn buds and be able to get around that circle, you know where it is, so you can place that hot iron all the way around the outside properly. That's when you can start. So we want to do it prior to fusing to the skull. That can be a real bloody mess if we're not dealing with those things in a timely fashion. And then you're going to have to basically break a horn off the skull, which causes its own unique problems. So how is it done? You're heating it up, following directions, whatever you have. Do you have an electric one? Do you have a gas one? Do you have a battery powered one? Placed on the horn bud area for about 20 seconds. You're looking for that copper ring to form all the way around the horn bud, basically killing all that tissue all the way down to the skull. Cauterizing the entire bud, you're cutting off the blood supply, and that tissue should die over time. And then you're going to hopefully cauterize everything and then possibly scoop some things out. Try not to leave anything behind. Pain mitigation. I certainly would appreciate that if it were me. Thinking about, yeah, I've got to get a tooth pulled here in June. They're going to knock me out for that. So considering the last one I had pulled I didn't enjoy that process being awake for it. It was partially because she didn't tell me what she was doing. And to separate that tooth root from the bone up front, it sounded like a gun. There's a vibration thing they do, and it sounded like a gunshot went off in my head. And it was like, whoa. It was like, but they have to, basically break it loose to get it out. So, so, take care of your teeth and then hope that the cap they did put on lasts. So I have a gold tooth up on this side that's become infected. So, and before it goes crazy and blows out through my nose, we need to get it out. So, so lidocaine blocks is a really good idea. If some people, we used to put them to sleep, but I'm not sure if that's legal anymore. Considering what I grew up with the holding the animals down and the fighting and bawling and all that stuff, a little pain medication to numb everything, and then something to keep them, knock them out is making sure we get everything centered, everything there long enough all the way around. It's a whole lot easier when the animal's not struggling. Um, and just it's a whole lot more pleasant too. So making sure that we've got anti-inflammatories afterwards and beforehand is going to make that calf feel a whole lot better. So advantages, bloodless, relatively quick. If you can get everything um, taken care of, we got to make sure that we do the job right. So learning how to do things, how to handle the heat, how to manage that heat on the skull, making sure if we do everything right, it can be very, very effective. If not, we see our failures in the next 3 to 6 months. Disadvantages, restraint is necessary so that animal's not bouncing all over the place and you get that heat application in the right area. We've got certainly the possibility of failure if we don't get everything cauterized around. You can get those half horns growing out. And you can also, those half horns tend to curl. And we had certainly a couple that were missed growing up where this corn start growing into the side of their skull. So you have to come in and the vet's got to cut it off or else it's going to work its way in. Or it was working its way in. So if we're not allowing enough heat, you're just going to cause pain and a lot more pain, and you're not going to get the job done. There is the possibility of burns doing this, especially if you don't have the animal properly restrained. It's very easy to take that dehorner and touch anywhere on your body, and you're going to have a nice 3rd-degree burn pretty quick. Smell is not a lot of fun, even if you've got no pain with that lidocaine. It seems that smell will put that animal into stress mode. I don't enjoy that smell either, but I don't scream, I guess, when I smell it. It's a lot more invasive than the paste. If you're trying to pop that thing out before you leave, so you can have a little hole there and it doesn't always look real pretty. Other methods that are not recommended. So I think we have some of these in one of those display cases that is up at the Utter classroom. That used to be in the dean's office. We got to get that hung up at some point. So has everybody seen these different approaches or not?
Yeah, I've seen.
So you're taking that, restraining that animal. You're getting on either side of the horn. I think I've seen it where they try to circle around the horn and then pop it off, and that can like take the entire section of skull off, and there's a little hole left, blood all over the place. It's very gruesome. So the scoop, the ball there is so you can push with your hand. And then you got the sharp end down here. that works around that horn, and you're trying to cut out all that actively growing horn tissue. If this is too small, you're just going to take the center out and you're still going to have horn growing on the outside. So you have to size these correctly, or at least these two correctly, to get that done. So basically, cutting out a hunk of skin with the horn in it, it can be pretty gruesome. You got to learn to pull arteries and things like that to make sure everything gets taken care of. Guillotine, it's basically a bolt cutter turned on its side. So you've got, instead of the bolt coming in this way, you've got the guillotine coming up there. So especially on a larger animal, you're going to hear cracks. You're going to hear all kinds of things, particularly if it's not that sharp. And the last one is kind of ugly. I don't think I've ever seen or heard of that. You're taking the wire there, and that wire has rough edges on it, and it acts like a saw. So you take enough wire, you establish a handle on either side, and you go back and forth until you get that sawed off. And that, I'm not sure it's a sound I want to hear, but I guess it's also could be used in amputations and things like that. Maybe that's where it originally came from. And when you're dealing with something that big, fully grown horns, it effectively an invitation or amputation. So you're dealing with many nerves. I think you could also say you're dealing with many blood vessels. There's blood all over the place when you're using these things. And they are very prone to infection. So especially if you get into those sinus areas, who knows what the hell's going to happen. So the more trauma we have, the more compromised that animal is going to be, the less they're going to eat, the less they're going to grow, the less they're going to perform with these more drastic methods. So staying on top of things with our hot iron, with our caustic paste, if we can do things a little bit more proactive when the animals are younger, there's an opportunity there to get things done. So other things that we might consider, ear notching. So we take a notch out of the ear and we screen for a BVD test. So you have a little V-shaped blade in usually a cutter. It slides through. It's kind of like a hole punch. So when is it should be done? Soon after birth. We can trying to distinguish between the transient infection, short term, and the persistent infection transferred in utero. So trying to figure out if we need to get our herd clean in some way, shape, or form. It's an opportunity to take that ear notch. So we got sharp edges. It clips out a small sample of the ear. We take that sample and send it in for testing, placing it in a serum tube or a small milk tube. I'm not sure if we put any preservative in there or not. I would think so, or else it's just going to rot and you're not going to be able to get results anyway. So I imagine there's a preservative somewhere in there. Easy to do. Can ship dry or stored in a freezer. I guess we're freezing things. Does not affected by cholesterol antibodies, so you won't have a false negative by those are the antibodies from the colostrum. If you're doing a blood test, you're going to have some things there. So they're checking the tissue, and long term, it doesn't appear to affect the calf. What is it with pigs? They use ear notching to number them. Like there's a system where you get every litter gets a number, and then every piglet in that litter gets a number. So the number of notches they have on their ears when they're born will determine things later. Sorting things out, figuring things out keeping track of everything. So they seem to, ear notching seems to be a fairly easy thing to do. So you've got your base plate down here, and then you've got the sharp edge on that V there that is going to go through. You need that sharp delineation to get a good cut there. So you got kind of an anvil and a sword, making sure we get that cut. I would imagine it's no different than doing an ear gauge or something like that. So, especially if they're young, they don't fully understand the world yet. It's over before they realize what happened. Removal of extra teats. So, why do we want to do that as the animals get older, or before animals get older? You've got teats there that are at least have a teat cistern, probably a gland cistern, and a little bit of secretory tissue. They are going to come in and start to lactate just like the other four, but our machines are not designed to do that. So we've got one on the back right there and one in between on the left. I think I'm looking at the rear udder, right? My initial impression was it's the rear udder, but I'm like, maybe it's standing funny. I don't know. Yeah, so we got a but. Yeah, so if she's standing uphill, maybe it could be. I don't know. So why do we get rid of them? They're unsightly. They're going to interfere. If they get big enough, we'll start misattaching things the wrong places, and they seem to predispose the animals to um, mastitis, or could be a reservoir. They're going to get infected. They're going to secrete milk. They get infected because we don't milk them out on a regular basis, and they might become a reservoir for various contagious organisms, environmental organisms as well. So, removing, how's it done? You got to make sure, and this is the challenge, at least it was for me, is which one's the extra one. So making sure you know which one's which, and if you don't cut it. You have to come back later and make an adjustment. So you don't want to cut off the wrong one. So sometimes it's really obvious they're not in the square or whatever, but other ones like I don't really know which one's the problem. So disinfect the area, taking sharp sterile scissors or blade, and then basically just cut things off. If you can get the teat bud out early enough, um, it should not develop any type of a quarter as they go through puberty. So lidocaine can be used, but like where I grew up, we're just doing it real quick. You got a little twitch and it seems to be over. So how do calves get them? We're suggesting it's hereditary, like all the extra toes on the cats, right? Cat's got 7 toes on the front leg or whatever it works out to. Um, so again, thinking about this, consulting your veterinarian. So learning from your veterinarian, asking for training, checking for welfare regulations. The people in this country have very specific opinions of what they think agriculture should be. Part of me says that no, they shouldn't be making those decisions, but that's where we are in capitalism right now. If they can advertise a certain practice used by our farmers, that seems to have financial benefit for all concerned. So we try to get that done. Medications, which the banning of aspirin certainly came as a surprise. what can we do? How can we dare? So have your valid veterinary client patient relationship as we go through. So but there was more to that. Guess not. Any thoughts or concerns? Pretty straightforward. Okay, so Emma, I got the